My name is Bianca, and the person I had was Joseph Lister. So Joseph was born April 5th, 1827. He died February 10th, 1912. A little about Lister. He was acknowledged as the father of antiseptic surgery. Joseph Lister's contribution paved the way to safer medical procedures. His introduction of the anesthetic process dramatically decreased deaths from childbirth and surgery and changed the way the medical industry looked at sanitation and proper hygiene. Lister's education. Lister was the second son of Joseph Jackson Lister and his wife Isabel Harris, members of the Society of Friends or Quakers. Lister, a wine merchant and an amateur physicist in the microscopics, was elected a fellow of the Royal Society for his discovery that led to the modern atromatic microscope. While both parents took an active part in Lister's education, his father instructed him in natural history and the use of the microscope. Lister received his formal schooling in two Quaker institutions, which laid far more emphasis upon natural history and science than did other schools. He became interested in comparative anatomy, and before his 16th birthday, he had decided upon a surgical career. After taking an arts course at University College London, he enrolled in the Faculty of Medical Science in October 1848. A brilliant student, he was graduated a Bachelor of Medicine with honors in 1852. In the same year, he became a Fellow of the Royal College of Surgeons and House Surgeon at University College Hospital. A visit to Edinburgh in fall of 1850 led to Lister's appointment as assistant to James, the greatest surgical teacher of his day. And in October 1856, he was appointed surgeon to the Edinburgh Royal Infirmary. In April, he had married Sim's eldest daughter. Lister, a deeply religious man, joined the Scottish Episcopal Church. The marriage, although childless, was a happy one. His wife entering fully into Lister's professional life. When 3 years later, the Regis professorship of surgery at Glasgow University fell vacant. These words are like so hard to read. Lister was elected from 7 applicants in August 1861. He was appointed surgeon to the Glasgow Royal Infirmary, where he was in charge of wards in the new surgical block. The managers hoped the hospital disease known as an operative sepsis, infection of the blood by disease-producing microorganism, would be greater decrease in the air in their new building. The hope proved vain. However, Lister reported that in his male accident ward, between 45 and 50% of his amputation cases died from sepsis between 1861 and 1865. In 1834, Friedland Freinem, I don't know how to say your name, discovered phenol, also known as carbolic acid, which he derived in an impure form from coal tar. At that time, there was uncertainty between the substance of creosote, a chemical that had been used to treat wood used for railway ties and ships, since it protected the wood from rotting, and carbolic acid. Upon hearing that creosote had been used for treating sewage, Lister began to test efficiencies of carbolic acid when applied directly to wounds. Therefore, Lister tested the results of spraying instruments, the surgical incisions, and dressings with a solution of carbolic acid. Lister found that the solution swapped on wounds remarkably reduced the incidency of gangrene. In August 1865, Lister applied a piece of lint dipped in carbolic acid solution onto the wound of a 7-year-old boy at Gloucester Infirmary who had substance a compound fractured after a cartwheel and had passed over his leg. After 4 days, he renewed the pad and discovered that no infection had been developed, and after a total of 6 weeks, he was amazed to discover that the boy's bones had fused back together without the danger of suppuration. He subsequently published his results in The Lancet in a series of 6 articles running from March through July. So Lister's carbolic steam spray. Lister moved from Scotland to King's College Hospital in London, 1881. He was elected president of the Clinical Society of London. He also developed a method of repairing kneecaps with metal wires and improved the technique of mastectomy. He was also known for being the first surgeon to use gout, ligatures, sutures, rubber drains, and developing an arterial tourniquet. He also introduced a duelet spray of carbolic acid combined with its surgical use. However, he abandoned the carbolic acid sprays in the late 1890s after he saw it provided no beneficial change in the outcomes of the surgeries performed with carbolic acid spray. The only reported reactions were minor symptoms that did not affect the surgical outcome as a whole, like cough, irritation of the eye, and minor tissue damage among his patients who were exposed to the carbolic acid sprays during surgery. So that was it. My the websites that I used were Wikipedia. I didn't make a slide for it, but I did use Wikipedia, and that was all.